Dr. Ed Boshnick, and I appreciate being invited to present a very interesting clinical case on the Fluorescene website. This is a story of about a patient, a 60-year-old woman with an acoustic neuroma. So 20 years ago, she had this tumor removed. And after the tumor was removed, she was unable to close her right eye completely. And over the years, the cornea started going south, and ulcerations and very dry eye. She came to see me around 3 years ago, and I explained what we could do for her with a scleral lens, and she got a little frightened and thought about it and decided not to pursue this. And last summer, things got worse for her, and her corneal surgeon asked her to come and see me. And during that time, he put on Doctorate also. So I fit her with a scleral lens, but when she first came to see me, this is how her cornea looked. You can see how nasty this surface is. You can barely see the pupil. And we took an image with the keratograph. You can see ulceration here. And then we put a scleral lens on, and you can see how the surface is very distorted, it's pretty irritated. So anyway, about 4 weeks into fitting her with a scleral lens, the surgeon, the corneal specialist, wanted to concentrate just on the oxervate. So we stopped with the scleral lens fitting, took a break for about 2 months, and then we restarted again several months later, around October of last year. So this is, again, how her cornea looked in the beginning. The oxervate really didn't do much to help her out. So we did this in sequence. So approximately 6 weeks after we started fitting her with a scleral lens, it started clearing up a little bit. You can see the difference here. And also with the keratograph, you can see the ulcerations have significantly gone away. The cornea's cleared up. And again, several months later, you can see how the cornea is less disruptive. Several months later, the cornea continues to clear up, and you can see the neovascularization and the scarring is getting better, and the ocular surface, in this image taken with the keratograph, looks better too. And then finally, earlier this year, in January, we took further images. Again, here you can see the scleral lens. Now you can see the pupil. There's a dramatic change in that, in the appearance of a cornea with the scleral lens. And look with the OCT. Look at the corneal surface. If you compare it to how it was in the beginning, can we move over here? Look, this is how it was when we first met her. And then approximately 5 or 6 months later, it's so much clearer. And this is the scleral lens. We used a one-fit scleral lens made by Blanchard Laboratory. And when the patient first came to see us, visual acuity in the very beginning was basically finger counting. You can barely see the pupil here. With the overrefraction with the scleral lens, she was seeing 20/20 minus with this eye, with this lens. So it's just a great case and a great demonstration of a therapeutic ability of a well-designed and fit scleral lens. Lens fits nicely, everything looks good, and the patient wears the lens, and she has a great comfort with the lens too. Before her eye, she had a lot of discomfort and pain. Well, actually, the sensory nerve endings were damaged, so she wasn't able to experience much pain with this eye, but she was more comfortable, and a dramatic improvement in her visual acuity. So that's all I have to say about the tremendous life-changing ability of a scleral lens.